My name is Norm Volsky, your host, and this is the Digital Health Heavyweights podcast.
Thanks, Norm. It's an honor to be here, and it's been fun to work with you over the years.
Hello, and welcome to the Digital Health Heavyweights podcast with your host, Norm Volsky. And today we are thrilled to be joined by Tim Church. Tim, welcome to the podcast.
Thank you. It's a real pleasure, and I'm really looking forward to this because you're wearing boxing gloves.
Well, I'm not going to be wearing them very long, but we got to play the metaphor for a few seconds. But for all of our viewers and listeners that are not as familiar with Tim as us, Tim is the Chief Medical Officer at Wondr Health, formerly known as Naturally Slim. He was also one of the co-founders of Catapult Health, that also got recently acquired by Teladoc. So very, very much a pillar within the digital health space. And in addition, for people who don't know, Wondr Health is a leading digital behavior change company that prevents and reduces the cost and impact of chronic health conditions. As one of the country's leading clinical thought leaders in weight loss, exercise, and obesity research, Dr. Church oversees Wondr Health's advancing efforts to transform the health of individuals, workplaces, and the world around us by empowering people with lifelong behavior change skills and tools. He helps lead the development of Wondr Health's curriculum, which is inspired by his medical expertise. Dr. Church also earned his Bachelor's of Science in Animal Physiology at UC Davis, and his MD, MPH, and PhD all at Tulane in New Orleans. So really excited to have Dr. Church on the show, who has published over 300 clinical articles and has been featured in New York Times, Wall Street Journal, Oprah, and many more. So thank you for joining us, and excited to talk through your experience and your knowledge, within digital health.
It's a real pleasure. This is going to be fun.
Yeah, absolutely. So, I ask everyone, what got you into healthcare? What inspired you to become a doctor?
It's funny you asked that, and then we're going to talk about digital health because it's actually all connected.
Yeah.
It's going to sound ridiculously lame, but I wanted to be a doctor to help people.
That's not lame at all.
It's that simple. There's no overriding narrative. And through med school, I quickly saw, there's two ways you can help people. You can help people one-on-one, or you can create systems or impact systems that impact tens of thousands of people. And I'd never dreamed of that prior to med school. I went to med school, I wanted to be a surgeon. And as I got into it, I'm like, man, I kind of like working with groups. I kind of like working with lots and lots of people. And that's what kind of drove me to go do research after med school, because I knew I was deficient in some things and I had to and it was kind of funny because reflecting back on it, how right I was. I vividly remember having this conversation with a classmate and saying, hey, there's this thing, and it's called the obesity epidemic, and it's coming.
Yeah.
And this is way back in the 90s. And I said, this thing's coming, and it's going to be a big, big deal. And no one's paying attention to it. And anybody who would listen to me, I'd tell them about it. And it's odd because unfortunately I was very right. And I didn't realize that not only was this a big wave, it was going to be a tsunami. So that's really how I got into this whole thing of A, working with populations, and B, around behavior and how it might relate to things like physical activity or weight.
Yeah, 100%. So walk us through your experience as a co-founder of Catapult Health.
Yeah, well, in the beginning, it was amazing. It was everything you would think. It was a bunch of friends get together, solve a big problem.
So who was in that group? Walk us through how that group formed, where the idea came from, how it went from an idea to an actual company.
Well, Scott Thompson and David Mitchell had done companies together. And then Todd Whitthorne, I knew them, but Todd Whitthorne introduced them to me around the public health side of it. And so they had already worked through see if this sounds familiar. They had already worked through the technology. They just didn't have any science yet.
Yeah.
That's the playbook of every healthcare tech company. And so I sat down with them and said, hey, the employer's where the action is. I'm seeing all these people in my studies. They've all got insurance, and I'm the one diagnosing their hypertension. I'm the one diagnosing their diabetes. The system's broken. People aren't going to their doctors. So let's take the doctors to the people. And that's literally how it began. And it was really, really successful. Good. And then of course we, like everybody else, COVID was a major reset.
Yeah.
Because these are on-site clinics, and so now there are no on-site offices anymore. So there was some pivots and became more digital, and between point A and point B, a lot of different things happened.
Yeah, that's fantastic. So walk us through, greatest challenges outside of COVID, because that was something that no one could have predicted.
The greatest challenges change almost every year. I know that sounds crazy, but I don't want to go back to COVID. I want to go back to COVID. The explosion of 20 bazillion startups, and it just diluted everything. And then when they started failing, and people who said no to us before, say at Wondr, are now coming back and saying, "Can you help us?" That's the biggest challenge right now, is both the dilution and then the lack of science-based companies. I am blown away by how many weight loss companies are 99% tech. It's like, yo, there's a million experts who could have helped you. All you had to do was go talk to one expert, pay him $1,000
Yeah.
and talk to them, and they could have really put you on a good path. And you didn't. And now you're totally selling snake oil, but you're using all the right words, so it
Yeah.
sounds legit. So that's probably the biggest challenge. I call it popping balloons. I walk into a room and I pop all the balloon myths right now.
Yeah, the biggest challenge is differentiation. Everyone says they can do the same thing, and it's very difficult for a benefits leader and even a benefits consultant to be able to sift through, the real legit companies that actually can, achieve cost savings or improved clinical quality or, improved clinical access, or ideally all three of those things, from the ones who don't. And instead, what it has created is the burden of proof is on the companies, and it is 100, maybe even 1,000 times harder to sell something now to an employer or health plan for that matter than it was 10 years ago.
Especially weight loss.
Especially
Weight holds a very special place in our society.
because also it's the first real niche industry that got disrupted. And there are companies that promised big things that even had a lot of financial success, in the markets or in an acquisition or something. But the results weren't there. A lot of what they promised wasn't actually
for sure.
seen
Which
in
hurts
cost
everybody.
savings and seen in better adherence and seen in behavior change. So you have these organizations that invested millions, if not tens of millions in dollars into something, didn't get the results, and now they're thinking, well, we can't make that same mistake again. We got to make sure if we pay millions now, it works.
100%. And, all of that, we all have biases when it comes to weight. We all do. It holds a really special place in our world. It's not quite religion. It's not quite politics. It's not quite money. It's somewhere in the middle there. When you walk into a room, you got to figure out, all right, who had the aunts who had the bad bariatric surgery? Who has the neighbor that lost 150 pounds on Wegovy? Everybody brings biases to the table.
Yeah.
And those biases impact how we make decisions for large groups.
Yeah. There's a lot of confirmation bias where someone
Yes.
believes something, they see one data point that proves that correct, and then they believe it, take it as gospel, and they're very hard to move off of.
These things create doubt because they're on social media. They're getting all these. If you're selling something that's not legit, just put it on Instagram. You got instant volume. And so it kind of makes me sad. I talk to really successful people on a weight loss program, or people who really understand the space, and even them are coming to me with questions about fads. I'm like, you know better. Like, why are we having this conversation? But the stuff's so convincing. It's so good these days. I was just talking to somebody, ironically, a government official, and they're like, well, what are we going to do about this? I said, just get the truth out there. Just publish, digitally put out there what we know works. Just we need a source of truth because there's no source of truth right now.
Well, sadly, if you're looking for truth, I don't know if you look, towards your government, you look
I know.
towards,
I know.
large employers, it's like it's the Wild West out there. Very, very crazy time. So walk us through your greatest successes, both at Catapult as well as Wondr.
I'll stick more on Wondr because that's my full time job. And over the years, I had
Yeah,
less
I'll ask
responsibility.
like how both factored in and how you split your
You
time and
know,
how you were able to, be an officer of both
Catapult's
companies.
simple. Catapult was helping those people who didn't know they had an issue. I think we had 2 million people we screened.
Yeah.
Um,
Identifying issues that people didn't realize they had.
Ticking time bombs. I
Health
used to say
concerns.
our job is to find the ticking time bombs. The person whose hypertension is so out of control that the stroke is right around the corner. The person whose blood sugar is so out of control they don't understand that what they're experiencing is type 2 diabetes. So that part of it. But on the Wondr side, man, we help people lose millions of pounds a year, and that's cool. I like that. We focus on humans. Like we don't treat the scale. I can move the scale doing anything. That doesn't. We focus on humans. I want to focus on your sleep. Let's talk about your drinking. Let's talk about your resilience. Let's talk about your stress. And I love it when people come back to us.
The triggers for behaviors, not the
They're all
behaviors
connected.
themselves.
They're all connected. You're not going to lose weight and keep it off if you're sleeping horribly. You just aren't. Everything's connected to your weight.
Yeah, if your stress is out of control, you're eating not because you're hungry.
Yeah. No. 100%. I jokingly say we're a mental health company that pretends to be a weight loss company. And when people come in and say, man, I learned so much about resilience from you, and I used it outside of your program. Man, I didn't realize my sleep was horrible. And when I worked on my sleep, everything else in my life came together. Man, I've never had so much energy. I'm leading the life I want to lead. And they don't even talk about the scale. They don't even talk about weight. Yes, we want weight loss. That's our job. But to me, it's kind of a given. I love it when people come back and said, you've made my life better.
Yeah, I like that. I like it a lot. Obviously, that's tremendous successes, one at a time, which is really, really good. Everyone who watches this, at some point or another, they're either an entrepreneur, they want to be one, they at the very least, are interested in that, kind of area. What was it like bringing in, some of those first customers, at both Catapult and Naturally Slim at the time, now Wondr?
Well, again,
Um, Walk me
naturally.
through some of those meetings and processes when you didn't have the data that you have now.
Oh man. Oh, you know the story. We had sold stuff that was going to needed to be online in 2 weeks, and we hadn't filmed it.
Yeah,
We were filming like 7 days in advance. We were like
yeah,
writing the scripts, and I mean teleprompter scripts, like the night before, racing into the studio, filming it, and be like, that's pretty good. And then a week later, it's being projected to 20,000 people. So
yeah,
in the beginning, we were barely staying up with the production schedule. It was awesome.
yeah,
And I mean, the good news, I've written so many programs that the content, I wasn't super worried about it. I was more worried because at the time I had zero experience in front of the camera. And it's terrifying. It's hard. They'd be like, bring more energy. I'm like, that's all the energy I got, dude. like,
yeah,
I'm done. So I think in the beginning it was everything you would think. And then the wins. You'd win this huge account and you'd be like, yay, we won. Oh no, we won.
yeah. It's like now we got to actually deliver.
And this one customer in particular, and I don't remember the exact numbers, but we launched these guys. They're huge customers, huge, 400,000. And we're projecting like 1,500 participants in the first week. And I think we enrolled 9,000 in the first day. And we had put together this cute little this poll that every 1,000 customers it went up, and it only went to like 2,000. We did 9,000 the first day.
Yeah,
We're like, uh-oh, I think we got something.
that's really cool. I love that. So, what did all this teach you about running digital health businesses?
Timing. Timing's everything. One day you're king of the world, next day you're struggling to beat last year. Changes in technology, changes in regulation. Today's world moves so fast. Timing's everything. And if you make the mistake of thinking that today's environment is tomorrow's environment, you're done.
So how do you stay ahead of the curve? How do you create a company that lasts, that's, still in business a decade
How you stay
later,
ahead of the curve?
even though there's sexier companies that come and go,
Yes.
that at certain times like get all the spotlight, but like you've been at two companies and founded two companies and like been a part of them that have lasted.
4. You've missed 2.
Yeah, walk us through.
I've
Okay,
got a genetics company, Genetic Direction, where we
I
help
like
people
it.
with genetics around weight loss. And then Fix Fitness Interactive Experience is a gamification where zombies chase you if you don't get enough steps. So in all 4 companies, the cyclical nature. But you said something really important back there, and I just kind of lost it for a second about discipline. Discipline. Oh my God, I see one more fly by night company. And then, the investors want your opinion on it. And you're just like, it's a fraud. And then the investors hate you. Like when you deliver real news, bad news that they don't want to hear, like they get mad at you. Like, well, why'd you even ask me then?
Wait, let me just understand this. These are investors who want your opinion. You tell them your actual opinion and they're mad because they
The whole
want
time.
you to confirm what they already believe, that this is the greatest thing since sliced bread.
All the time. And
Yep.
I'll do it for
I
friends or
find that a
people.
little amusing because I'm an investor as well. And, I literally go out of my way to find someone who will be willing to poke holes. Like those people are worth their weight in gold because I would argue the people you want to be surrounded by are the people capable of telling you no and people that are willing to tell you what you don't want to hear.
Yeah. And I'll use DPP. Everybody forgets. DPP, whatever it was 15 years ago, yeah, I was part of the DPP study. I know it inside out, upside down, left, right. And everybody and their brothers tell me about this DPP thing, and the government's going to pay for this, and there's going to be billions of dollars. And we all know the companies that got spun up around DPP. And I said the unpopular thing. I said, this isn't going to work. This isn't going to work because A, it's an old intervention. It's not modern weight loss. It's good, but it's old. B, you're labeling somebody to treat them. I'm calling you a pre-diabetic so I can treat you. No one wants to be labeled. No one wants to be called anything. Why would I step into this thing where someone says, "Hey, you don't have any hair. You're ugly." Oh God, we're friends then, I guess. It makes no sense to label somebody. And then the one that made me laugh the most when they said, "Hey, the government's going to pay for this for Medicare." I'm like, "Oh, you mean just like cardiac rehab?" Because that failed miserably. And they did exactly what I thought they would do. They pay for it with all these restrictions. So there's no volume. And they're never going to change. And DPP, I got so many nasty looks and so many nasty comments and just almost blackballed in some places because I'm like, this isn't going to work. It fundamentally is flawed. And man, no one wanted to hear it.
The truth teller is not always the most popular person.
No, and I'm not, the problem with that is you're taking a risk. It's so easy just to go along and be like, yeah, DPP's great, let's do it.
Yeah.
But you got people cheerleading this who really don't understand the topic, like truly understand it. And that's what you're up against. And again, DPP is a great example. I can go on and on and on and on, though, about. And what's weird is from my career, because I feel young, but I'm now seeing certain fads come around for the third or fourth time.
Yeah.
I'm like, how can this be happening in my lifetime? Like, how can I be on this fad for the third or fourth time?
Yeah. Very, very interesting. So I want to make sure we highlight the companies that are doing the right thing, that are building companies based on evidence and based on science and are actually driving results, for health plans, for employers. So you've mentioned the areas that you're skeptical of, the companies you're skeptical of. Which companies do you respect? Which, areas of the digital health ecosystem are you saying, you know what? These types of companies, these areas are the right places to invest time, resources, and money into if you're a benefits leader.
You're not going to like my answer.
Well, the good news about this podcast is I can edit anything. So if I don't like it, I just don't include it. Just kidding. Just kidding.
No,
No, but I'll debate it. Like, I'll give you a different perspective and we'll talk about it.
I don't think you're going to disagree with me, but I don't think you're going to love this.
Please.
I think there's three things that comes into play in digital health: health, digital, and getting paid. Okay. What I see is either they're really, really good at the intervention part or they're really, really good at the technology part. Like, it's very rare you see companies that do both well. The intervention part, you can imagine, like, they're usually ex-academics. Yes, your program worked awesome in a research study. And guess what? I've ran more behavioral research studies than most human beings that ever lived.
Yeah.
And the lab is very, very different than the real world. Because when you're sitting at your desk at your company and you see my email or my text, you didn't invite me into your day. Okay. When you come into my research lab, you're begging to get in my study.
Yeah.
So it's a very different dynamic. So, I see this constant tug of war between tech and I'd call intervention or healthcare. But more importantly is, how do you get paid? Because direct to consumer, you're just trying to get someone to swipe a credit card. That's it. Swipe your damn credit card, life goes on. But if you're playing with insurance, oh my goodness. Every employer, every carrier, it's a fist fight. Benefits brokers, you got to get everybody aligned. And I think that's another challenge. Is we were born in the employer space. Our parent company was a benefits consulting company.
Holmes Murphy.
Holmes Murphy.
Yep.
Huge advantage for us, because Holmes Murphy would come to me and they'd be like, hey, we need you to do this in the program. Not clinically, just how we did things. I'd be like, that's crazy. That doesn't make any sense. And we would do it and it would work. And I'd be like, I stand corrected.
Yeah.
And it was because they understood the employer space and I didn't. I sat on Jenny Craig's medical advisory board. I've sat on Nutrisystem's medical advisory board. I've done a lot of DTC stuff. It's a total different beast than the employer play.
Yeah.
And
I've seen companies come in cocky from direct to consumer that left very humbled. And there's a long line of skeletons on that trail.
Long line.
I don't care how big your budget is. I don't care how big your bankroll is. Look, like Amazon tried it and they fell on their face.
Hey, our sales cycle.
If Amazon can't figure something out, then I would argue most companies can't figure it out. So, you've seen all these big brands, D2C, come into digital health. Oh yeah, we know what we're doing. We're different. We're this, we're that. They come, they struggle, they leave.
Every win is a fist fight. Every single win. Every employer we bring under our umbrella, we got 2,000 of them. It's a fist fight. And a lot of people just don't have the stomach for it.
And most of the time, it's ego. That's what's coming into play. It's big companies that have had success in other places saying, hey, we're going to run the same model that works for one, and we're going to be different. We're going to be the one that figures it out. It's like, if you don't have experts around the table, you don't come in really humble, willing to listen, willing to take advice, seeing how it's done in a very, very unique niche area, you got no chance.
Yeah, you're spot on. You're spot on. And it's just so different. But, the challenge is, if there's one person on that decision-making team that used that company individually, and now you have to unbias them, you can always tell when you're selling a group and somebody says, well, what about this company? You're like, oh no. Oh no.
because they're already inclined
They're
that like
already
that's where they
going
want
there.
to go.
Yeah, they're already going there. You know, I like to remind people when it comes to weight loss, everything works for somebody. That's not the challenge. The challenge is how do you work across a whole population? From the truck drivers to the surgeons to the lawyers to the custodians to the C suite. How do you work across a whole population? That's the challenge.
Yeah, and I would say this, because the burden of proof has increased 1000x from even 5 to 10 years ago.
But don't get me, we're going to talk about that now.
And we will, and I can't wait for it. But I will say if a company cannot drive a hard ROI in ideally month one, but especially year one, and go at risk on their deal, ideally bills a claim, use utilization based pricing, and ideally like take a percentage of cost savings, you're cooked. You're automatically second choice, second priority. So there are a very, very select few of companies that I've seen being in this industry for over a decade that can actually do all those things right now. And I'd argue that list of companies is less than 15 total, and very few people truly know who those companies are, why they're succeeding, what makes them different, and then everyone else is just noise.
Norm, we got to hang out more often. You're spot on. You said, well, first of all, most people completely bake their weight loss outcomes. I mean,
Well, I'm not talking just weight loss. I'm talking in the entire
no,
industry.
I'm getting there. I'm using weight loss as an example.
We're talking weight loss, on-site clinics, care navigation.
Sure. And you
There's a
can
couple of niches that actually save money and drive savings.
100%.
I know who those companies are and I see them thriving and I couldn't be happier for them. But sadly, the thousands of other companies just throwing shit against the wall and seeing what sticks, they are making it harder for those companies
Yes.
to get more implementations because benefits leaders, benefits consultants are so confused by all the crap that's out there that they assume even the 1% and less of companies doing it right, oh, they're full of shit too.
Yeah. Now stick with me on this because we're saying the same thing. You can bake your outcomes. And I'm using weight loss as an outcome. I don't care what your outcome is. You can bake them pretty easily. All right, they have to have been in the program at least 6 months and they have to check in once a week. You can bake your outcomes. We're seeing billion-dollar companies baking their outcomes. What you can't generally bake is a real ROI. A real ROI, not a fancy Excel spreadsheet.
More importantly, a guaranteed ROI where if we
thing.
don't achieve it, you don't pay us.
That's us.
And we're willing to stick our necks out for it. And there are only a very few companies willing to do it, and there's a reason they're willing to do it.
Yeah. But
no one is willing to work for free.
No, and it's hard to calculate an ROI. You need a massive sample size. Massive. Like when we do our ROIs, we start out with hundreds of thousands of people. And it's not even the people that you intervened on that you need, it's that control group. That's where people miss it. It's like you need a group to match them against, and you have to have a massive data set to do that. Now, we've done it multiple times with carriers. Our ROI is insane. Our latest ROI, which I don't even like to say out loud because it makes me nervous, is 4.6.
It's about as high as I've ever heard.
You know why? COVID. Got metabolic issues post-COVID. So where we were kind of in the 2 to 3 pre-COVID, suddenly we're like 4.6 to 6. And I'm looking at this going, this isn't even believable. Like this is great data and I know it's legit, but
scary it's so more than anything.
I think it comes down to the COVID thing because we've got the data. No one's talking about it. But post-COVID, prediabetes spiked, metabolic syndrome spiked, hypertension spiked. So we've got all these people right now who really stand to benefit from what we do. And it doesn't take that many ER visits to swing a massive ROI. And we're super cheap. I mean, we're hundreds of dollars a year. We're not talking about thousands of dollars a year. So if you've got a very reasonable cost and you've got a very sick population, which we have right now, you have the opportunity to drive this massive ROI. And that's what we do. But we get asked by companies all the time, oh, we want to do an ROI analysis. I show them the waterfall plot of when we do it with a carrier. When over here, we're starting with 300,000 people. And then they get knocked down to 50. And then they get knocked down to 15. And we end up with 7,000 that qualify as a control group. So, yes, there are very few of us that have the data, but there's a reason. A, the data is hard to get, the raw data. B, you got to have the right people analyzing it. Because I'm pretty good at analyzing data, but this actuary stuff, not so much. So it's tough to get a real ROI.
So you've seen a lot of companies come and go. You've seen a handful that have stuck around for a very long time. What do you think are three crucial traits that digital health founders have to have to be
Leadership,
built
leadership,
to
leadership,
endure and succeed?
leadership.
And what does that mean? Like what do they do? What do these founders do that others don't?
You know, I just, it's amazing to me, and I love sports. I play a lot of sports. I always, in sports, when Mike Krzyzewski had to leave in the middle of the season, and you watch Duke go from like 19-1 to like lose 7 in a row, I thought to myself, that's the same players, it's the same arena, that's the same fans. The leadership has changed. I think in the business world, it's even more important. And I would have never guessed that prior to working in the business world. I think right now, because things move so fast, and you asked me a question earlier, and it's, you have to actively be looking for the next trend. And then you have to actively be questioning, is it real or not real? And you have to have a response for both. Like compounding right now, you can't put your head in the sand about compounding. And compounding is going to go one of two directions. It's either going away, or the government says, we don't care. Have fun, guys. So we have to have a position for both those. And that costs resources, but you have to have the leader brave enough to do that, to be like, hey, we got an uncertain future. We're going to plan for both. And I'm sorry, guys, but what I said last week might not be what I say next week. And I think mastery of the topic. I'm amazed at how often I talk to people who don't even understand the company they work for. I'm like, dude, you're running a diabetes company and you keep using the wrong phrases. So leadership, being bold, paying attention to which direction the winds are blowing. And then lastly, mastery of the topic and mastery of what you do as a company.
Yeah, absolutely. You're a huge proponent of having doctors and clinicians involved in digital health companies. And you mentioned like there are literally hundreds, if not over 1,000 companies that could have saved themselves a lot of time and energy. You know,
Yeah, this
a
is
lot of
fascinating.
frustration if they had just gotten some experts, like in the very early innings of starting a company. How do we inspire other doctors to leave traditional, safe, practice of medicine and take this route, which is obviously higher risk, but also higher reward?
So it's a great question. And one of the biggest failings I see is the ER doctor, the family practice doctor, the pediatrician, who then just jumps into corporate America and doesn't make any attempt to learn group-based medicine.
Yeah.
Population-based medicine. And so I think the people who are the most successful are the ones who have an MPH or somewhere we're involved in population-based medicine, because population-based medicine is so different than the individual-based. It's like they're two different beasts. So clinically, it's one of the biggest failings I see. Really, really smart people who are crazy smart, but their past is influencing them too much in this new role. And it doesn't, their past doesn't bring a ton of helpful experience to the new role. If I'm a company and I'm looking for a CMO or a science person, I'm not just hiring. I'm going consultants first.
Okay.
And I'm going to find a consultant I really like. And then little by little, I'm going to bring them into the company for real. Because this is a different beast, working with employers and working with carriers. And, no one cares about your 37 years of experience. No one cares about your 3 graduate degrees. No one cares about your triple boarding. I mean, they don't. All they care about is, how can you help me? So at a population level, as quickly as possible, figuring out what their pain is. And if you can help them with it, is what matters. It really comes down to being a better listener. And we as doctors are not great listeners. We're better talkers, as evidenced by the last 41 minutes with me.
Well, as you were saying that, something was going through my mind where I'm like, a practicing physician in a traditional medicine setting, they talk, people listen. And that's been their whole career since the second they started. Like, even their first job out of like residency, it's like, okay, but like, yeah,
It's
like I
probably
talk,
the
patient listens, like order, they follow. They go into this and it's like, it doesn't matter what they think. It's what the payer or employer thinks, and it's listening with the intent to respond and actually packaging something together that appeals to their goals and not, oh, because I told you so.
yeah. It's and I'm sitting here interrupting you now. It's one of the toughest skills I work on every day. And when I first came into this gig, whatever it was 14 years ago, I was horrible at it. All I wanted to do was talk. I just wanted to show up and show people how smart I was. And I credit Holmes Murphy because they took me out on a lot of sales calls for their benefits consulting brokers. And I watched these guys and I watched what great listeners they were. And even when people were saying ridiculous things, they just listened. And I'm like, that's how you connect. That's how you make a difference. You don't basically bully people into making a difference. Like you listen, figure out their problem, and then help them with their problem. It might not actually be a problem that's in the top 10 list, but it's the one they care about. They're not going to get to their top 10 list until you help them with the one they care about. I think Den Bishop said it best. I'm going to screw this up, but people don't care how much you know till they know how much you care.
Yeah. Yeah. And how can you have a great sales pitch if you don't even know what they care about? Because people make decisions based on what they feel are their biggest needs, not what someone tells them they should be focused on.
Absolutely.
Yeah. Really, really cool stuff. What do you wish digital health companies did more often?
Failed quicker, so there's less of them.
Yeah.
There's too many of them. We used to roll into these meetings and people would meet with us just because we was so interesting. I mean, they just were literally like a kid at an amusement park. What do you got for me? Now, now you're like their 12th meeting this week on this topic. They're exhausted. They've heard all the same phrases. I just wish as an industry we did a better job of rank ordering the legitimate companies, and we've in the last 3 months there's been two different companies that won business. I thought one was out of business. I didn't even know it was alive. And this company went with them. I'm like, I don't mind losing, but they're not even alive. I don't know. And then another one, I'm like, they're not even in weight loss. I know, but they're going to spin up a weight loss thing. So you're going with somebody who's going to spin up a weight loss program as opposed to going with us who's worked with 2 million people. So that's the stuff that,
Did you get answers of why they chose to go those routes?
do you ever get the truth?
Usually not, because most people don't have the courage to tell people.
Here's what I see, and this is not going to make friends. I see digital companies that are failing will say whatever it takes to close a deal.
Of course,
Like whatever it takes.
desperate companies, desperate people do desperate things.
Yeah, and it's tough sometimes to compete against that on a topic where no one on the other side of the table is probably an expert. Or they figured out what you want to hear and they're going to double, triple, 10x down on that particular topic. So that to me is one of the bigger challenges is going up against people who will say anything to close a deal. And you know what happens? Those companies come back to us in 9 months. A massive, massive company is coming back to us right now from 9 months ago who went with somebody. And I knew them really well. I told them, I said, you guys, I love you guys. I've known you forever. This is going to end badly for you. But we're always here for you.
Mm-hmm.
And they're back. So we get a lot of them.
Yep. I love it. that it happens, like the companies come back to you, um, and are willing to,
Hey,
admit a mistake, and
especially with
do
these
the
with
right
the
thing.
GLP-1s, the outlandish promises, because there are too many options. There are too many teledoc weight loss companies going on, and no one's getting volume. We are. We're doing fine. But a lot of these guys who have lots and lots of money invested in them, they're not getting the volume because there's too many Me Too's out there. And
Yeah.
I hear some crazy stuff come out of those guys. Or we'll hear it from someone they try to sell. And I'm like, that's total. It's not only fiction, it's malpractice, what they just described to you.
Yeah.
So, yeah, I see a lot of it in the weight loss medication stuff.
Yeah, I think the holy grail of digital health is behavior change. If you can get people to change their behavior, you have something special. If not, you're just like everyone else.
I agree, Norm, completely. I'll tell you the challenge with that.
Yeah, walk us through how you can
Ugh,
ensure behavior change and why it's so hard and why so few are able to do it.
It's just hard to do because you're learning a skill. It's like me saying, Norm, I'm going to teach you how to ice skate. And day one, we're going to get you ice skating probably okay. You're going to have a chair, you're going to push it around, you're going to feel pretty good, you're still going to fall. A week later, you're going to be better. A month later, you're going to be even better. A year later, you're going to be better. You know, but if somewhere in there you stop ice skating, when you come back, you've gone backwards. We'll pick you up where you were. So behavioral skills take time to build. They take time to deliver. They're hard. And right now, especially on the weight loss medication thing, let me go back to my original example. Our week one video, because we're super video based, our week one video used to be an hour and 20 minutes. I mean, can you imagine rolling out an hour and 20 minutes video in today's world? Our week one video now is down to like 20 minutes. But my point is, we have these two opposing forces. I want to drive behavior change, but I need to do it in less than 6 minutes. And it just, the physics of it don't work. So what really matters is what behaviors does this person need? And that's what I'm going to focus on. So almost more important than the behavior change part of it, but it's rather identifying where this person struggles. So we do screenings. Are you an emotional eater? Are you a social eater? Are you a rigid eater? Then your curriculum will be specific to that. Not because it's better for you, but the non-norm, you're probably not an emotional eater. You don't want to have emotional eating material.
Hmm.
It's a waste of your time. So if we can make it as efficient as possible and then double and triple down on the skills when we know what skills that person needs, that's how you win the game these days.
Yeah, I love that. So you mentioned GLPs, obviously that's all the rage, it's all anyone's talking about in this sector. As a doctor, what is your take on GLP-1s and when is it appropriate course of action for the patient, and when is it not? Because again, I have a unique viewpoint on this because for most of my childhood, my dad was like obese. And, it was tough on the family because we love him and we want him to be around and we wanted, as we were younger, during our youth, we're like, hey, we want him around when we're getting married and when we have kids and like he is now. But about, 15 years ago, he got gastric bypass, which is like a huge sacrifice to make and like a huge decision to make. It seems to me like GLP-1s are like the shortcut, to a gastric bypass. It's like you get all the same benefits without having to go under the knife. And
You're
that's
hacking
kind of
my emails. You're
and that's
hacking.
kind of how it's positioned. So I want to get your very strong, very informed opinion on what GLPs are good to use for and where it's missing the forest from the trees.
You're hacking my emails. I keep telling everybody, I'm like, we've been down this road. It was called bariatric surgery.
Yeah.
Like everybody's acting like we're starting from scratch here. No, we've learned a lot of lessons in bariatric surgery. You described it so well because in a weird way, you're throwing away your old self and creating a new self in the biggest way. When you walk into a room down 60 or 80 pounds, everybody treats you different.
Yeah.
And some good things come with that, and some bad things come with that. And this is one of the things where people are missing the mark on GLP-1s as you lose a lot of weight, saboteurs come into your life. Not everybody in your support circle remains supportive. You have certain expectations. When I lose this weight, my daughter's going to talk to me again. When I lose this weight, I want to get a job promotion. They're not connected. If you think they're connected, that's where the self-harm stuff comes into play. So there's kind of two phases. The beginning phase of GLP-1s, where you're dealing with nausea, and then you're dealing with nausea, and then you're dealing with nausea. And then after they've had success, the honeymoon's over a little bit, and you're helping them understand this is their new life. That's the challenge. But here's the thing about GLP-1s, and no one saw this coming. Stick with me on this one. It's a miracle drug. Not because of the weight loss, because of the anti-inflammatory benefits. Mm-hmm. So the fact that we're seeing this so powerful for strokes and heart attacks, so powerful. I know I said strokes and heart attacks. I don't want a stroke. I don't want a heart attack, but I'll take a heart attack over stroke. So powerful for liver health, so powerful for kidney health, so powerful for sleep apnea. And it's going to be there for mental health, and it's because of these powerful anti-inflammatories. We're all going to be on GLP-1s within the next 10 years, not for weight. Like you, Norm, teeny little dude, you're going to be on a drip of these things for healthy aging.
Interesting.
That's way down the road, but that's where these things are going. And that's really what you have to think about.
But you also said it before, like there's more people on them than should be. So walk us through how you're like, hey, everyone's going to need them or want them or use them in 10 years. But right now, too many people are getting access.
I wouldn't say too many. I would say they're being used too aggressively.
Okay.
Because think about tirzepatide, Zepbound, whatever there is, 5 doses, 6 doses. Okay, the second dose produces 16% weight loss. It's comical. It's insane. And so not everybody needs to drive up to that highest dose and get the 40% weight loss. I think we're about to enter this era of smarter weight loss. Mm-hmm. Like, what's the right weight loss trajectory? And I talk about this a lot, and people look at me like I'm crazy. I'm like, there's 3 priorities in this order. Number 1, side effects, obviously. Number 2, clinical goals. Clinical goals. Why are you doing this? Are you doing this to lower A1C? Are you doing this to lower blood pressure? Third is weight loss goals. Of my 3, weight is the least important when it comes to using GLP-1s. And that middle one.
Skinny people that have heart attacks, there are very obese people based on like the BMI scale that have a very long life expectancy.
And I think we're going to get better. The problem with what I just described is we're not going to have the clinical trial data anytime soon. And so what's going to happen is you're going to have opinion pieces coming out of all the big societies. But that's where this is going to go, is that you don't have to go to the highest dose. We have to figure out kind of the optimal weight for you, not the most weight loss, but the optimal for you. I think that's the challenge facing all of us moving forward, is how do we do smarter weight loss, not more weight.
Yep. The other hot button, you can't go to a single healthcare conference where people don't talk about it, is AI. It's like GLP-1s and then AI. And if there's a company that's like, oh, we're leveraging AI to better administer GLP-1s, the VCs are frothing at the mouth. Should they see one of those? So I'm just curious, what's your take on AI? How do you think it's going to impact healthcare? Because usually whatever we see in consumer tech and banking tech, we don't see in healthcare for another 20 years. So what do you envision AI leveraging within healthcare, just knowing that we tend to lag other industries?
Like the highest level, I think AI takes over.
And what does that mean?
I think, and when my emails are going to get, I think doctors are hosed. I really do. When AI, in a weird way, medicine is AI. You learn algorithms. That's what you do. Yeah. You memorize algorithms. And if you don't have it memorized, you go pull out your book, or you pull out the piece of paper on your sheet. I mean, that's what AI is. It's algorithms.
Yeah. It's a science. It's not an art.
No. But at a clinical level, I think eventually it only makes sense. I can tell you where AI is only as good as the data you put into it. And we talk about MySpace weight loss, there's not a lot of data to put into it. So we already have these algorithms. So even if the AI spits out an algorithm, it's going to match our algorithm because there wasn't that much data to work with. I am excited about AI. I think it's going to lag in the weight loss space compared to general medicine space.
Yeah.
But yeah.
I think it can make clinicians and just anyone more efficient. And what I'm most excited about AI is it's going to allow people to work top of license. It's going to allow them to outsource a lot of tasks that can be done by anyone or anything, and so that they can focus on the most high leverage tasks. So, do I think AI is going to replace humans? No. Do I think it's going to make the most capable humans more efficient and more valuable, and like the mediocre will get replaced by AI? 100%.
But you know what's interesting about what you said? It's about leadership. Like, this isn't about being the smartest doctor in the room anymore. This is about leading a team. I keep telling doctors this. I said, you're going to be leading a team. This isn't about you going into a room anymore, writing the scripts. Maybe the nurse knows what's happened. No, this is about you leading a team that everybody comes up to you. And I keep telling doctors, go get some damn leadership skills. Go get some formal leadership training because you didn't get it in med school. Because as you say, it's actually beyond top of license. Like, they're going to be at the top of the license. And then they're going to have a team below them. And boy, you better have some leadership skills, because being a leader is not an intuitive thing. You better be trained on it.
Well, I think something you'll get a kick out of and laugh is that, I think most venture capitalists, they chase IQ way too often. They see a very brilliant person and they come from
Entitled.
Harvard, or they come from Wharton, or they come from Oxford or wherever. And
Yep.
that VC says, you know what, this person is so smart, they're so driven, and they're so this and they're so that, they're going to be successful. I just know it. I feel it in my core. I feel it in my gut. What's interesting about a really brilliant, very capable, someone who can accomplish a hell of a lot as CEO, they are the bottleneck in their company, because the company can go only as far as they can produce themselves. But what a lot of people miss is EQ is 10 times more important, if not more, because it's not like which CEO can get the most done and have the most success in a 8-hour time frame each day, or some crazy CEOs will work 20 hours and only sleep 4. Still, like, they are only able to achieve what they can produce. The more effective founder CEO type is the one that can make everyone around them 20 to 30% better, because that in the aggregate's way more important than what they can achieve in a given day compared to their CEO peers.
I would layer onto that, every phase of a company's growth needs a different CEO.
Yeah.
Like, in the beginning, you need that crazy person doing napkin deals.
But they need to be able to inspire others.
Exactly.
Unless they can get everyone else at least somewhat as excited and passionate and invested in that idea as they are. But if it's only, hey, I'm just going to do it and people better follow, you're not.
No, 100%. But usually the others is like 6 people.
Yeah, true.
But then as the company grows, and you're still medium sized and cool, but then when you transition to larger, it's a total different leader. That's been one of the most fascinating things to me to witness, is the idea that there's almost like a certain set of skills you need for each phase of a company's growth.
100%. So I ask everyone who comes on the podcast, how do you practice what you preach? We talk healthcare, we live it, we breathe it, we help others, live healthier lives ideally, but how are we doing it ourselves? So how do you reduce stress in a very stressful job and, continue to exercise to stay your best self?
The years didn't give it away. I did jujitsu. I'm a 7-time world champion. I fight people every day. Yeah, it's what I love to do. As you age, you start to realize the things you really don't like, but you were doing them anyway. And then the things you love, and you double down on those. I love jujitsu. I love the cerebral element. I love fighting human beings. It's a real source of truth. When you fight a human being, you either won or you lost.
You picked the right career, considering, you got to fight every single day if you're a digital health executive. trying to get your solution up to the top of priority list when there is a lot of noise.
It's the same thing.
It is. And then lastly, I think one of the biggest, if not the biggest determining factor of human health is what we put into our bodies. So how do you practice what you preach from an eating standpoint? What are some of your core philosophies yourself? And what are some healthy recipes you make at home that are pretty easy to, execute that might inspire someone to try something new?
You know, you're going to be surprised by this. I lived in Southern Louisiana for 14 years.
Mm-hmm.
You put a
Not
really
the
good,
healthiest cuisine if you had to categorize it.
no, but you put any New Orleans dish in front of me, I will lick that plate clean. To me, you've got to live. You've got to live, but it's if you know that's what Saturday is going to be like, then be better Thursday and Friday.
Yeah.
If you talk about diet, I land very heavily Mediterranean. Very heavy Mediterranean. I eat very little fried food. I eat very little red meat. I eat red meat very little, but Mediterranean when in doubt. Like to me, I'm a 90-10 guy when it comes to diet. I
Mm-hmm.
try to do the right thing 90% of the time, 10% of the time. I'm going to eat the damn cake.
Yeah. As you should, because then
Yeah.
otherwise you're just gonna binge.
But I know my body, and this is key to this. You got to know your body. I can exercise my weight off because I eat better if I'm exercising. If I'm not eating, I eat horribly.
Yep.
So for me, it all starts with exercise. That's my formula. And one of the things we preach to people is figure out your formula. When I'm training hard, like I have to eat well. I have to sleep well. If I'm not training hard, if I'm traveling, we could do a whole hour on travel. Nothing destroys healthy habits like traveling.
If you let it.
Yeah, again, diet 90-10.
Love it. Well, again, Dr. Church, really appreciate the time. This was certainly one of the most fun episodes I've had and really enjoyed it. Thank you so much for your very, fresh and unique perspectives. And, we'll keep progress on how, Wondr and, some of the other companies that you're supporting are doing. And thank you so much for joining us.
Thank you, Norm. I really enjoyed it.
Thank you for joining. Please like, comment, and subscribe below if you enjoyed it.